Hi, Dr. Sandy here again. This is the actual Pope strap. So if the patient does not have a forward head posture and they just have loss of cervical curve, and also we utilize this often when maybe they have loss of disc height, but they can't handle any type of jaw pressure, so the distraction jaw chin strap that we have another video of would not be appropriate for them because they can't handle any pressure onto the chin area. This strap, I went ahead and put it on so you can actually see what it looks like when it's completely set up. It's a different setup with a back pull because it has a spring system hooked by a spreader bar, but I'm going to take it off and then kind of explain that these little ringlets will come off. This forehead strap is just basically removed like this, but on the rear side of this strap you can see there's extra padding so that there's not any, it's not uncomfortable in the occipital area, which a lot of tractions, the straps are so uncomfortable to the patient's head that they don't enjoy the experience or the journey that much because it's so hard on them. So once again, the padded part of the strap goes onto their forehead, the Velcro comes apart. One of the most common mistakes when your team or your rehab techs are putting patients, or your CAs are putting patients into this traction, is they sometimes go super tight, and then so you could always ask the patient, is that too tight? Because then it feels like their head's being compressed. And then the other mistake that's made is that they make it far too loose to where once you put it attached the ringlets to the spreader bar, it slides right off their head. Making sure that these pieces, and Addie, raise your arm, that these pieces are nice and symmetrical and the ringlets are facing towards the spreader bar is real important. So they just have to make sure the straps are set up, just right, and then go ahead and place your arm like that. And then you can see as I pull back just with my finger, it's nice and comfortable for the patient. And the same thing for the other side. You just want to make sure that these ringlets are being pulled back nice and equal, because if you pull on one side more than the other, you'll start to either create a head rotation or possibly even some lateral flexion. So making sure that everything is nice and even before you apply to the spreader bar is very important. All right, thank you.